Hello and welcome to our channel. In today's video we will discuss about a very important topic, that is about women health problems like PCOD, osteoporosis, menstrual problems, dysmenorrhea, cardiovascular disease, UTI, that is urinary tract infection, breast cancer, and hormonal imbalance. So these are the major women health problems, and along with this we will also introduce a very powerful supplement which was launched by Team Vestige for women health problems. So let's start our today's video, that is women health problems. So first of all, we will talk about women's life cycle. So as we all know that major life transitions such as pregnancy, motherhood, and menopause can create physical and emotional stress in women. Negative life experiences like infertility and perinatal loss, poverty, discrimination, violence, unemployment, and isolation also impact on women's mental health and well-being. Menstrual cycle, as we all know, is a part of women's body way of preparing itself for a possible pregnancy each month. Women usually have periods between the age group of 13 to 50 years approximately, and the body undergoes through many physiological and psychological changes during that phase. Recent studies have suggested that the age of menarche is often slightly reduced in girls who are subjected to emotional stress, and so in the case with the menopause. So now basically we will discuss about the common diseases among women's. Now one by one we will talk about them. So the first common disease among the women is anemia. Now what is anemia? What do you understand by the term anemia? How will you know whether you are anemic or not? And if you are anemic, then what you need to do? So we will talk about that. So let's talk about anemia. So anemia happens when the number of healthy RBCs, that is red blood cells in your body, is very low. Means they are reduced. And as we all know that red blood cells, RBCs, carry oxygen to all the body's tissues. So a low RBCs count indicates that the amount of oxygen in your blood is lower than it should be. And many of the symptoms of anemia are caused by decreased oxygen delivery to the body's vital tissues and organs. Anemia is measured according to the amount of hemoglobin, the protein within red blood cells that carries oxygen from the lungs to the body tissues, is called hemoglobin. We'll talk about the symptoms, signs and symptoms of anemia. So people with anemia appear pale and may often complain of being cold. They may also experience lightheadedness or dizziness, especially when active or standing up. Second, there is unusual cravings such as wanting to eat ice, clay, or dirt. Third, they will be having trouble concentrating or tiredness. Next, there will be constipation. Next, some type of anemias can cause inflammation of the tongue, resulting in a smooth, glossy, red, and often painful tongue. If anemia is severe, fainting may occur, and other symptoms include brittle nails, shortness of breath, chest pains. Blood oxygen level can be so low that a person with severe anemia can have a heart attack. If you get a physical examination, you have anemia, so your results may show high or low blood pressure. Second, pale skin. Third, jaundice. Fourth, an increased heart rate. Fifth, a heart murmur. Next, enlargement of the lymph nodes. Next, splenomegaly, which is also called as enlargement of the spleen, or you can say enlarged spleen. And hepatomegaly, which is the enlargement of liver. There will be atrophic glossitis of the tongue. Glossitis basically means inflammation of the tongue. So your tongues will be swollen, they will be inflamed, red, hot, glossy, with too much pain. So now how will you know that whether you are anemic or not? So what are the investigations now? So you may go for CBC, that is complete blood count, thereby knowing your hemoglobin present in your body. You may know very well whether you are anemic or not. So in the CBC, hemoglobin will indicate whether you are anemic or not. So this was all about the first disease, which is very common in women, that is anemia. Now next disease is thyroid problems. So as we all know that thyroid is a small butterfly shaped gland which is located at the base of your neck, just below the Adam's apple. And it's a part of an intricate network of glands called the endocrine system. And the endocrine system is responsible for coordinating many of your body's activities. The thyroid gland manufactures hormones that regulate your body's metabolism. Hypothyroidism and hyperthyroidism. Now what is hypothyroidism and what is hyperthyroidism? So first of all, we will talk about hyperthyroidism. So hyperthyroidism is a condition in which there is an excess of thyroid hormones, that is T3 and T4. So whenever the secretions of thyroid hormone increases in your body, so that is called hyperthyroidism. It may lead to goiter. It may lead to grave disease also. Now what is hypothyroidism? So hypothyroidism is a condition in which your thyroid hormone secretion will be lower in your body, and it may lead to Hashimoto's disease and thyroid nodules. So this is called hypothyroidism. So this was all about the second problem, which is common among women, that is thyroid. Now next disease which is common among women is cardiovascular disease, means the disease which are related to your heart. So let's talk about it. So heart disease is the most common cause of death of both female and male. One challenge is that some heart disease symptoms in women may be different from those in males. Now, what are the signs and symptoms? What are the clinical features of cardiovascular disease? So, first symptom, there will be pain in chest, pain in shoulder, nausea, shortness of breath, severe headache, fatigue, vision problems, difficulty breathing, blood in the urine, and pounding in the chest. So these are the signs and symptoms of cardiovascular disease. So this was all about the cardiovascular disease. Now the next common disease among women, that is breast cancer. So let's talk about breast cancer in a very brief manner. So breast cancer. So breast cancer is a cancer that develops in breast cells. Typically, the cancer form in either the lobules or the ducts of the breast. Lobules are the glands that produce milk, and the ducts are the pathways that brings the milk from the glands to the nipple. Cancer can also occur in fatty tissues or the fibrous connective tissues within your breast. The uncontrolled cancer cells often invade other healthy breast tissues and can travel to the lymph nodes under the arm. The lymph nodes are a primary pathway that help the cancer cells move to other parts of the body. Now, what are the symptoms that you may have of breast cancer? So let's talk about them. The first symptom of breast cancer is a breast lump or tissue thickening that feels different than surrounding tissues and has developed recently. Second, breast pain. Third, red pitted skin over your entire breast. Next, swelling in all part of your breast. Next, a nipple discharge other than a breast milk. Next, bloody discharge from your nipple. And the next, peeling, scaling and the flaking of your skin of the breast. And the next symptom, a sudden and unexplained change in the shape of your breast and the size also. There is inverted nipples. Changes to the appearance of the skin of your breast, a lump or a swelling under your arms. So this was all about breast cancer. Now next, another common disease, that is PCOD, that is polycystic ovarian syndrome or disease. So let's talk about PCOD. So polycystic ovary syndrome is a condition that affects a woman's hormone level. Women with PCOS produce higher than normal amount of male hormone, that is testosterone. This hormone imbalances causes them to skip menstrual periods and make it harder for them to get pregnant. PCOS also causes hair growth on the face and the body and baldness also. And it can contribute to the long-term health problems like diabetes and heart diseases. Polycystic ovary syndrome affects a woman's ovaries, the reproductive organs that produce estrogen and progesterone, hormone that regulates the menstrual cycle. The ovaries also produce a small amount of male hormone called androgens. And PCOS is a syndrome, a group of symptoms that affects the ovaries and ovulation. Its three main features are cyst in ovaries, high level of main hormone, that is androgens. Third, irregular and skipped periods. So this was all about this PCOD. Now next common disease among women is osteoporosis. So let's talk about it. So osteoporosis is a condition that affects the bones. Its name comes from a Latin word means porous bones. People with osteoporosis are at a high risk of fractures, bone breaks, while doing routine activities such as standing or walking. The most commonly affected bones are the ribs, hip bones, and the bones in the wrist and spinal cord. Now, what are the symptoms of osteoporosis that you may know? So, the early stages of osteoporosis don't cause any symptoms or warning signs in most cases. All about the osteoporosis. Now, the next disease which is common among women is UTI, that is urinary tract infection. Let's talk about it. So, a urinary tract infection, which is called UTI, is an infection from microbes. These are the organisms that are too small to be seen without a microscope, means we cannot see them with the naked eyes. They can only be seen under a microscope. Most urinary tract infections are caused by bacteria, but some are caused by fungus, and in rare cases by the viruses. Now, what are the signs and symptoms of lower tract urinary tract infection, that is UTI? So, they include: first, burning with urination. Second, increased frequency of urination without passing much urine. Third, increased urgency of urination. Next, blood in the urine. Next, cloudy urine. Urine that looks like cola or tea. Urine that has a strong odor. Pelvic pain in women. Rectal pain in men also is there. So this was all about UTI. Now next we will talk about a very important topic, that is hormonal imbalance. So, as we all know that hormones are the body's chemical messengers. They travel around the bloodstream, telling tissues and organs what to do. They help control many of your body's major processes, including your metabolism and your reproductive organs. When you have a hormonal imbalance, you have too much or too little of a certain hormones present in your body. Even tiny changes can have serious effects on your body. Now, what are the causes of hormonal imbalances? So, let's talk about them. So, the first and the foremost cause of hormonal imbalance is hypothyroidism and hyperthyroidism. Means you have disease related to your thyroid, that is hypothyroidism and hyperthyroidism. Second, diabetes. Next, stress. Next, you have eating disorders. Next, medications like birth control pills or others. Next, if you have an injury or trauma. Next, menopause. And the next cause is pregnancy or breastfeeding. Next, if you have PCOD, that is polycystic ovarian syndrome or disease, and if you have irregular menstrual cycles. And the next cause of hormonal imbalance is premature menopause. And certain type of tumors also are there, the main causes of hormonal imbalance in the female body. Now, what are the signs and symptoms of hormonal imbalance? Now we will talk about them. So, first sign and symptom. There will be weight gain, dry skin, water retention, pain, muscle stiffness, swelling in your joints. There will be depression, nervousness, anxiety, and irritability. There will be infertility. Next, there will be heavy or irregular periods, including missed periods, that is oligomenorrhea. Next, there will be excessive hair growth on the face, chin, and other parts of the body, which is also called as hirsutism, as it's a characteristic symptom of PCOD. Next, there will be acne on face, chest, and upper back. There will be thinning of the hair and there will be hair loss. So these are the various symptoms of hormonal imbalances in your body. So this was all about hormonal imbalance. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below.